We're diving into hand hygiene, a critical topic you will absolutely see on your phlebotomy exam. The test will expect you to know precisely when to perform hand hygiene and which method to use. Let's start with the when, which is best understood through the 5 moments of hand hygiene. The first moment is before touching a patient. An exam question might ask for the very first action you should take upon entering a patient's room. The answer is to perform hand hygiene before you do anything else. The second moment is before a clean or aseptic procedure. For a phlebotomist, this is right before you palpate a vein or don your gloves. A common exam trap is to present putting on gloves as an option. Remember, hand hygiene must happen before you put on sterile gloves. The third moment is after a body fluid exposure risk. This is an obvious step after the blood draw, but the exam loves to test tricky scenarios. For instance, if you touch a contaminated surface mid-procedure, you must perform hand hygiene and change your gloves before continuing. The fourth moment is after touching a patient. Once the draw is complete and the tubes are labeled, you perform hand hygiene as a final step of the direct patient encounter. The fifth and final moment is after touching the patient's surroundings. This is a frequently missed point. If you place your supplies on the bedside table or lean on the bed rail, you must clean your hands upon leaving, even if you didn't touch the patient directly after the procedure. To remember these, use the phrase 2 before, 3 after. This stands for 2 moments before patient contact or a procedure and 3 moments after body fluid risk, patient contact, or touching their surroundings. Now, let's focus on the how, because this is where major exam points are won or lost. The default method for routine situations where hands are not visibly soiled is an alcohol-based hand sanitizer. It's effective, efficient, and preferred in most clinical scenarios. However, the exam will absolutely test the exceptions. You must wash your hands with soap and water for at least 20 seconds when they are visibly soiled with blood or other body fluids. An exam question might describe a scenario where a blood tube leaks onto your hand. The only correct answer is to wash with soap and water. The most critical exception, and a guaranteed exam topic, is dealing with a patient who has Clostridioides difficile, or C. diff. C. diff spores are resistant to alcohol-based sanitizers. Therefore, if a patient is on contact precautions for C. diff or the question mentions symptoms like severe diarrhea, you must wash your hands with soap and water. Choosing alcohol-based sanitizer in a C. diff scenario would be an immediate wrong answer on the exam. Mastering the when and how of hand hygiene is not just about patient safety. It's about securing easy points on your phlebotomy certification exam by avoiding these common traps. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.